Yeah, we welcome you all to this special day with a special occasion, with a special person, Dr. Satish KS, who requires no introduction. And but still, I would introduce him with a one line. He is the current president of the prestigious Karnataka Pulmonologists Association. So this is a very unique program wherein we want to have a live chat with all those people who want to quit smoking. Over to Dr. Satish sir, who will now just talk about how to quit smoking the easiest and the most efficient way. Over to you, sir.
Thank you so much, Dr. Puneet, for organizing this, audience interaction, a live chat on how to quit smoking. Dear friends, as every year, World No Tobacco Day, WHO sponsored program. The event serves to highlight the health risks associated with tobacco use and exposure. By advocating for effective policies to reduce tobacco consumption and to decrease the children's exposure to secondhand smoking and encourage cessation of tobacco smoke and tobacco control. This year event will be held today, that is 31st, 2020. The theme this year is very unique, unlike the previous one. The previous ones were protecting lung health and so on and so forth. So this year is very unique. It is protecting youth from industry manipulation and preventing them from tobacco and nicotine use, focusing really on empowering young people to engage in fight against the big tobacco industry and barons. So it's very important that why WHO has given this theme, protecting youth from industry manipulation, and which means it's a big issue. Friends, tobacco continues to be the leading cause of preventable death, killing more than 8 million people across the globe every year. About 1.2 million of these deaths are the result of non-smokers being exposed to secondhand, smoking. World No Tobacco Day is an opportunity to call on countries to come together, to work together to end the tobacco pandemic. To learn more about this World No Tobacco Day, you can also visit various WHO campaign sites. They are very important, especially for younger generation, to learn about it, and parents to know about it, and teachers as well to be aware of what tobacco pandemic is causing this world, and to make our younger generation understand about the ill effects of tobacco in general. So this global campaign emphasizes the achievements and progress made throughout the year towards a tobacco-free world. This year, the theme, as I mentioned before, protecting the youth from industry manipulation, is important, as the tobacco industry is increasingly targeting young people as an emerging and vulnerable market for its addictive products. This is a pressing issue and a need and a challenge for tobacco control policy makers in every country, whether it is India or Africa or America, any other. According to 2015 data, I'm talking about 5 years, which might have changed now. 17% of young people between the ages of 15 and 24 smoke worldwide. This is very alarming because 24, 15% to 24% of our the 17% of young people between the age of 15 and 24 smoke worldwide. They are very young. In the European region itself, it varies from 11.5 in girls to 13.8 in boys who are smoking from age of 13 to 50. This has been decreasing over the years as a result of phenomenal efforts by the tobacco control community and various associations like our association. More must be done to safeguard the vulnerable group, the group between age of 15 and 24. As the tobacco industry is well aware, a person who starts smoking before the age of 20 is not only more likely to develop an addiction, but may also continue to smoke later in life and faces difficulty in giving up, you know, the smoking and have a control over this habit. The industry, as usual, willfully sells a deadly dependency product to the young people, and with the youth protection as the core theme of the World No Tobacco Day 2020, 31st May, is a chance to showcase the best practices to counter these efforts. How the tobacco industry targets youth is important to understand here. In its efforts to manipulate young people, the tobacco industry has resorted to selling or embellishing products to make them more appealing to specific group or demographics, particularly via packaging or branding, which we know that it has been going on for years now. This has been especially evident in the recent explosion of interest in the e-cigarettes and heated tobacco products. One of the most significant innovations by the industry involves, you know, the marketing or how they, sell these uh, product. Tobacco industries or tobacco companies are turning more and more to social media influences or influencers to market these dangerous addict forming products. Such advertisements often go around and circumvent traditional tobacco advertising and promotion and regulating, as the tobacco product placement is not flagged as an advertisement. So one has to be very careful in seeing the advertisements which do not really convey, but there is an underlying meaning in it. The issue is especially concerning in case of young women and girls who are a prime target for for exposure to this influence. World No Tobacco Day 2020 will demonstrate how young people can be empowered to take control of their health and reject tobacco addiction. I appeal here to the parents, to the teachers, to the healthcare workers here that be reminded of this addiction and reject the tobacco industries. World No Tobacco Day also calls on the tobacco control community to protect these groups via campaign and interventions across the society to build a kind of a resilience among the future generation of young people against tobacco and move steadily towards a tobacco free future. As you know, there are a lot of health effects of cigarettes or tobacco, which is important. Before we start, how do we circumvent this addiction? How do we help people who want to give up, smoking? It is important that we understand or we remind the younger people and others that cigarette smoking harms nearly every organ of the body. It's just not the heart disease, it's just not the pulmonary disease, it's just not the cancer. And this causes health smokers in general to suffer. Quitting smoking lowers your risk for smoking related diseases and can add years to your life. So one of the preventable cause of death. Before I really start telling people how to quit smoking, we must be aware of the dangers of cigarette smoking. I won't go into the details, but tell you so that people understand why they have to quit smoking, number one, or why they should not start smoking. Cigarette smoking is the leading cause of preventable, death in the world. Cigarette smoking causes more than 480,000 deaths each year in US alone. This is nearly 1 in 5 deaths. It's very alarming statistics. 1 in 5 deaths in the United States is due to smoking, and we are not far behind in India, in Southeast Asia. Smoking causes more deaths each year than the following causes combined, which we all know, the dreaded diseases: HIV, illegal drug use, alcohol use, road traffic accidents, and firearm related incidents. More than 10 times as many US citizens have died prematurely from cigarette smoking than have died in all the wars fought by United States. Remember this, because we always think that the wars can cause more deaths and injuries, but this addiction and smoking causes 5 times more deaths than all these wars. Cigarette smoking increases the risk of death for all causes in men and women, and the common diseases which are due to smoking. Number one, coronary artery disease. The coronary heart disease or ischemic heart disease is 2 to 4 times higher. For stroke, it is 2 to 4 times. Lung cancer goes up by 25 times. Women developing lung cancer is more than 25 times. In general, smoking causes diminished overall health issues and also increased absenteeism from work and increased healthcare utilization and cost. Any progressive country must be reminded of these indirect costs which are involved, that is absenteeism from work, cardiovascular disease, and causing ischemic heart disease is well known. The clot blocking the blood circulation. As a respiratory physician, we are all aware of the effects of cigarette smoke on lung disease, causes damage to the airways and the air sacs known as the alveoli, where the oxygen transport takes place. Is caused by smoking, including COPD, which causes emphysema and chronic bronchitis, which are irreversible diseases, can cause lung cancer. As respiratory physicians, we are always screening our patients for respiratory diseases like lung cancer, causes worsening of asthma, and smokers are about 12 to 13 times more likely to die from COPD than non-smokers. It's important during this COVID pandemic to know that smokers and who have pre-existing lung disease like COPD or asthma which is aggravated by smoking can lead to more mortality. And I know personally that many of them during this lockdown period have given up, smoking. There are other diseases and cancers which affect, men and women. The bladder cancer, the blood cancer. These are associations with smoking. Cervical cancer in women, colon, rectum, esophagus, kidney, larynx, liver, pancreas, stomach, you name it. So it doesn't only affect the 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 lungs and lung cancer. It also increases the risk of dying from cancer and other diseases in patients with other cancers. So it's important. Also, it affects pregnant women if they are smoking and their, infants. Premature delivery, stillbirth, low birth weight, sudden infant death. These are well known, complications of smoking in young women who are pregnant are smoking, and it can cause various other ill effects on the bone and on the gums and tooth and so on, causing oral cancers and bad oral diseases. It can affect the well-known problem of India, which is diabetes. The risk of developing is about 30 to 40%. Many do not know about this. That's why it's important that the patients are well aware of the effects of smoking, and it reduces the body, immunity and so on. Now, what are the advantages of quitting smoking? So why we are talking about it? What are the advantages? We learned about the ill effects of smoking, but now we have to understand why we have to, promote and make patients aware of this and give up their smoking, quitting and reducing the risk of smoking. Quitting smoking cuts cardiovascular disease. Just in 1 year after quitting smoking, your risk of heart disease comes down sharply. Within 2 to 5 years after quitting smoking, your risk for stroke may reduce to about that of a non-smoker. Fantastic. If you quit smoking, your risk for cancers of the mouth, cancers of the throat, the food pipe, and bladder drop half within 5 years. 10 years after you quit smoking, your risks from dying from lung cancer drops to 50%. So it's important to understand. So what I have done is to now to tell you about the World Tobacco Day, and then also the ill effects of smoking and what we are up to as healthcare uh, givers and others who are responsible. It may be even the government bureaucrats and government bodies which have to take policy decisions on making people aware and to cut down the smoking by various policy matters which are important. I also mentioned to you about the advantages of quitting, smoking. I will now show you some slides and about how to go about this. I'll share some slides which will depict about the uh, the World No Tobacco Days. The secret is out, which means you're saying to the tobacco gardens your product killed 8 million people each year. You would also target a new generation. They are replacing one who are lost by the new generation. So it's important uh, to know about the the effects of smoking, and it's also important that we understand about all this now, how to give up this smoking, which is an important thing that people keep asking us about, how we have to give up smoking. And it's very important that we know that many a time, you know when patients come to us for various other diseases, what happened, yeah, so what happens to them. So that is why it's important that this be exposed, and protecting the youth from industry manipulation and preventing them from tobacco nicotine use. Now all this I have shown you about this various tactics to market this in children and adolescents, or the free product samples, product placement, and single stick cigarettes, selling products at eye level for children, and product placement and advertising near schools are also important. And this is how it looks: tobacco advertisements, the newer and very subtly hidden agenda, and also exposing younger generation. The secret is out: tobacco exposed, tobacco free generation. So as I said, over 1 million people die from secondhand smoke exposure every year. Any form uh, of tobacco is dangerous. E-cigarette, shisha, smokeless cigarettes are all harmful, and there are many complications and ill effects associated with tobacco. This is about Indian prevalence, the uh, overall tobacco use, 48% of adult males and 20% of adult, females smoke in India. And not just urban population, every third adult from rural area and every fifth adult from urban areas reported current use of, you know, tobacco. And tobacco products in India are these, you know, gutka, kaini, zarda, cigarettes, hookah, and bidi, and so on. These are various kinds of, you know, smokeless tobacco, pan with tobacco, gutka, mawa, kaini, which many a time we have not, heard of it and aware of this, and that's why it's important to know about this, thing. Now, coming to how we have to go about it. Apart from this, and um, there are many questions of this, and how to go about it, and when you want to quit smoking, when you want to give up smoking, you may need a professional help. Many a time this is not done. Many a time at home, parents or friends would just say, hey, this is not good, you have to give up smoking. That is not going to help. It has such addiction properties that it's difficult. You must contact professional bodies or professional people and self-help groups which are available, and these group or professional like us, the doctors and other healthcare givers, psychologists for example, psychiatrists, they will help you in quitting smoking. So nicotine is highly addictive and it reaches the brain in quick and energizes, you know, the person who is smoking, and he definitely becomes more energetic, elated, but at the cost of all the things that I mentioned. So that is why nicotine products in any form, e-cigarettes, tobacco chewing, all this can result in all the complications which I mentioned to you. There are various nicotine receptors in the body and in the brain especially, and there are reward pathways in the brain which ask for more and more as you know patients continue to find, or smokers continue to find, their absence in their blood circulation. That's how one goes on smoking. These are slides to show the effects of nicotine on the brain. And remember, every smoker thinks at least a few times how to give up smoking, but he's overpowered by nicotine and its addiction properties. Every smoker, remember, tries to give up smoking. And the nicotine has effects on, as I mentioned, on every system in the body, and can cause severe side effects if it is exceeded. And an average smokers tend to lose 10 years of quality of life compared to non-smokers. I'm talking about quality of life and other, apart from other, health hazards it has, the cancers and chronic diseases, which I mentioned to you already about the effects of smoking. These are effects on the brain. That is why, one continues to smoke, and these go from adolescence to adulthood, and they continue to see this. Now, what does it do? Acute nicotine causes decreased motor activity, and there are nicotine withdrawal side effects, and that's why you again go back to smoking, because the side effects can be very severe, and this can lead to problems and nicotine dependence. The body has seen and is dependent on the presence of nicotine in an individual, and it's adapted to that. The various socioeconomic issues which are there, which I briefly mentioned, let me not go too much into it. But as healthcare givers, as doctors and professionals, the legislation, we must bring in also bureaucrats and legislations on smoking. And there are various acts which have been done, the Pollution Act, the Motor Vehicle Act, and so on. And similarly here is important to know that these have already been done. The tobacco control law in India is definitely strong, is becoming stronger, and there are sections. For example, smoking in in public place is banned, and we have to be even more severe in that. These are the public places where you just cannot smoke, and one has to be aware of this. Then there is also a national tobacco control program. So how do we manage uh, the smokers who are using tobacco when they come to us? We have to be very professional as healthcare providers. Every patient, especially young patient, we must make it a point to ask history about tobacco use. May not be just smoking. Sometimes they may be using tobacco in other forms, and that's why it's important for us to ask these questions, which I mentioned. Are you using tobacco currently? How often do you use? Many a time they think that it may not be too much. Oh, I hardly smoke. Hardly means 5 cigarettes per day, which is dangerous. 5 cigarettes, because they are comparing themselves to others who are smoking maybe 15, 20 or a pack. But smoking five when compared to them is less, but it's equally dangerous. So this is important to diagnose tobacco. It may not show so much in the beginning, and that's why everyone continues to smoke, because it has no acute effects in everyone. It may have some, but it doesn't. And later, it causes the dependence syndrome, the tolerance, the withdrawal, the craving, the loss of control, neglect of all pleasures, a continued use despite the harm. So that is the dependence syndrome. This is fingerstorm test to find out you know about these are very simple, and these are not you know very complicated one. So if we start talking about smoking cessation, we must do it professionally, as I said, and tell them about the benefits of giving up smoking. And these are the benefits of giving up smoking. There are immediate effects, and then there are lasting effects of giving up smoking. Immediately, within few minutes, heart rate, blood pressure drops. 10 years later, the risk of the lung cancer falls to about half of a smoker. And that's the importance of stressing. And within 2 to 5 years, there can be there can be cardiovascular decrease, uh, complications. Treating tobacco use disorders have two aspects: non-pharmacological and pharmacological, and we must address these issues. Non-pharmacological, which is important for me. pharmacological, is easy. So, but we must try non-pharmacological treatment, and to talk to them, to counsel them, and to go along with them, and never ever to say that, you know if you continue to smoke, don't come back to me. You quit smoking and come back to me. Never use this phrase. Always tell them, even if you continue to smoke, come and see me. I will help you to give up smoking. It may not happen at the first time. Cannot happen after 2 weeks, 4 weeks, 3 months, 6 months, or even a year. So be patient, and never to tell patient not to return to you for consultation if you continue to smoke. That's why it's important. So these are some of the questions: ask, advise, assess, assist in quitting, that is craving, and dealing with barriers, and arrange for follow up. These are 5 A's. And there are various levels, pre-contemplation, then thinking about it, contemplation, getting ready to quit, determination, taking action already, that is action, and recovery from relapses, and that's important. So as healthcare providers, we must be strong enough to face all this, and address these issues. This vicious cycle can occur of relapse from pre-contemplation, and that's how it's important for us to go through this maintenance and so on. So discuss with them about various issues, risks that are involved, rewards that which I mentioned, roadblocks which may be there, in quitting. Like for example, they may be going through some stress. It may be a physical stress or a mental stress. That's not the real time for somebody to give up smoking, and that's why it's important to tell them about the time. So setting up a time is important, as important as even thinking about it. So you set up a time to give up smoking. What is important in this frame, the feedback, responsibility, advice, is the empathy that's going to change and motivate that patient. So that's important to remember here. And all these work, especially when it's coming from a healthcare provider, these will definitely work. And patients start thinking about it. Why am I, spending time as a doctor? Why is he spending time to tell me about the ill effects of smoking, and to give up smoking? This is the WHO Quit Tobacco campaign. Distract, delay, drink water, deep breathing, and discuss. All these are important. Many a time there are barriers in this. The behavioral management, group counseling, which I tell you, there are self-help groups which are available in Bangalore. You can contact the Karnataka Pulmonology Association members for the self-help groups, which takes care of the uh, uh, people who are smoking and addicted to it, and would like to avail this facility. So that's the non-pharmacological treatment. Also, distract, which means which means getting into exercise, getting into yoga, and also about various activities to make them strong and give up this smoking. Now, failure of this, many patients, many smokers would like to ask what drugs are available, what pharmacological interventions are available, which I would like to take. They may start off saying, you know, initially itself that I want to take some medicine, which many of them will know, like for example, nicotine, products and replacement, nicotine replacement, not product. So here it's important for us to also believe and teach them and train them about the non-pharmacological, management. And after they fail, many of them underestimate their capacity to give up smoking. I have many patients and smokers who have given up smoking who are chain smokers, which means they continue to smoke throughout the day, and they after they give up, they find it, you know not so difficult. And many a time they have mentioned to me that, oh, I thought it is going to be a horrendous task, and that's why I never tried it, because it was affecting my mental health. And that is one lesson for us, that those who are heavy smokers, chain smokers, can give up smoking on their own with some help that is required. We must also warn them about the nicotine withdrawal side effects which are there, which they know: difficulty in concentration, and then irritability, anxiety, and so on. So the first step is to fix the quit date, and start anti-craving medication. As I mentioned, once the non-pharmacological treatment you know has been given to them, spoken to them, and counseling done, and remove any conditioning which I mentioned to you, and the replacement therapy can begin after that. And it's important to understand that not everyone requires nicotine replacement therapy. And also, we must also know the contraindications for nicotine replacement therapy, NRT, which is, for example, a heart disease and uncontrolled hypertension, uncontrolled diabetes are not the diseases where nicotine replacement can be advocated and can be advised. And it's important, whichever form of nicotine replacement, to be tapered off over slowly, not every week. It takes some 6 to 8 weeks to 12 weeks, sometimes even longer, uh, to take away the nicotine replacement therapy. And it can take few months sometimes. So what have we got? We have many forms of nicotine replacement therapy, which is chewing gum, adhesive transdermal patches, lozenges, sublingual, tablets, nasal spray, nicotine inhaler cartridges, nicotine toothpicks, and name it. All these are available, and e-cigarettes is mentioned here, but is only a last resort. As professionals, we should really not talk about e-cigarettes, but that's one of the things that's mentioned. And these are nicotine replacement products. There are also other anti-craving, medications which are there, like bupropion, which is a kind of antidepressant. And the history tells us that those who were on this antidepressant medicine, you know, had less number of these patients who were smoking. That's why it was effective and it was advocated, the bupropion. There are some problems associated with that. Not great, but one has to be careful with drug interaction and so on. Vernicillin, which is known as Champix, is a nicotine, partial agonist, and has been extremely useful. You get the initial starter pack and then the maintenance pack, very easy to understand for anyone, who wants to give up smoking and use vernicillin. I use vernicillin more than bupropion. Little more expensive than bupropion, but is useful. You start off with the initial, starter dose and then a maintenance pack, and continue for a few months at least. And patients get confidence after a few weeks, but hang on to that anti-craving medication for some more, because there can be relapses, and relapses can be again um, a, a bad time for both healthcare professional as well as patients to get back into it. But one must not lose patience here. You must keep egging patients and trying patients, telling patients, and talking to them about it is important. So the counseling aspect of this quitting smoking is more important than prescribing anything. Spending few minutes in your busy day schedule is important. It's worthwhile from the from both the patient side and the professionals. There are also drugs like nortriptyline, clonidine, beta blockers, anxiolytics, and antidepressants have a role, especially anxiolytics when they have withdrawal effects. The goal here is to prevent cigarettes from producing positive, reinforcing, and subjective, effects. So the goal is that to produce a positive, reinforcing, and subjective effect. So this is some of the um, pharmacological therapy, pharmacotherapy: nicotine gum, nicotine patch, nicotine lozenges, and then so on, bupropion, varenicline. All these are. Remember, only this will not help. NRT will not help. It's always the behavioral therapy, when associated, is the most effective way of treating smokers and patients. So remember, not just prescribing NRT, nicotine replacement therapy, is going to see the day light, but it's important to counsel them. Behavioral therapy is important, and many a time I have used like to be in touch with me every week initially about uh, whatever is happening with smoking, and many of them come back and messaging, uh, saying that they are trying, they have given up 1 week over, 2 weeks over, 23 days over, and so on. So it's sometimes very nice to see the fruits of what you have done and spend time, and give that positive message to the patients and smokers, saying that yes, you're doing well, you know you're you know you're a good man, and continue to hold on, continue to be strong. And that is really like reinforcing these patients. So remember, as I mentioned, e-cigarettes are not a part of tobacco cessation program. No doctor should advise, will advise patients, saying that e-cigarettes can be a replacement. Never do that. And e-cigarettes are not part of the tobacco cessation program. So these are some of the principles that we use for other forms of smoking as well, tobacco use, you know, to find out about the withdrawal and so on and so forth. So it's not just each individual, but something like this, and especially in a village setup, a health worker, talking about quitting tobacco, and to the school-going children, one must not be hesitant to talk about this, and protecting the young. That is the theme of the 2020 World No Tobacco Day, and it's important to engage also all the parties that are involved, be the government, the ministers, the bureaucrats, and everyone should be made uh, part of it to give up, the smoking. So these are some posters which are available, and one can download them and use them in the clinic and other office places, and these are definitely rewarding. So, so the best of the world say no to tobacco. So these are the icons in the field, and sports persons, the models, the film people. These are also important to convey the message to the young people, and these are posters to show the effects of the smoking on all uh, all walks of life. So let me end this talk by telling you about the associations or self-help groups which are also available. So make use of them, and cessation centers are there, and you must make use of it. And these are some of the things which one need to know about the vaping and so on. So in summary, so what I have done is to take you through what is World No Tobacco Day, the objectives of WHO organized sponsored World No Tobacco Day, then the ill effects of the tobacco in any form. Then I spoke to you about the advantages of quitting smoking and tobacco use, and then took you to the quit smoking or smoking cessation in brief, how a professional handles this, and why you must approach professionals help in successfully quitting smoking. How, as parents, teachers, and healthcare providers, we have a responsibility to take care of our younger generation, to take care of our future generation in making India, making world tobacco free, nation or world, in order to prevent the preventable deaths which can occur in this uh, in this world. So I hope those who are thinking about quitting smoking will resort to professional help and take care of their health, and contact the professionals who do this, and become completely smoke free and be healthy, and to live longer with good quality of life. Thank you so much for your patience hearing, and good evening and good night. Thank you.